Hi, everyone. I'm John Lynn, the founder and chief editor at Healthcare IT Today. I'm excited to bring you another in our series of interviews for our Interviews podcast. Today, we're going to be talking about healthcare analytics, and we have two special guests. First, we have Joey Fitz. He's VP of Product Strategy at Oracle Analytics. And we have Elina Petrillo, Assistant Vice President, HR Technology at Northwell Health. Welcome, Joey and Elina.
Hey, thanks, John. Good to be here.
Yeah, so I'm excited to have this discussion, but before we dive into the topic, Elina, you want to tell us a little bit about yourself and Northwell Health?
Yes, absolutely. I work at Northwell Health close to 20 years, innovating in the field of HR technology, and my team is supporting all software and all technology offerings for Northwell organization, which is the largest employer and provider in New York State. We have 23 hospitals and 750 outpatient facilities, and we are serving 75,000 team members.
It's amazing how big it's grown. Glad to have you here. Joey, you want to introduce yourself?
Yeah, hey, I'm Joey Fitz. I'm VP of Product Strategy for Oracle Analytics, which really means that I focus on ensuring the success of our community. So ensuring that folks like Elina are able to accomplish the great outcomes that she has.
Awesome. Well, let's talk about those. And, you just did a big conversion, I would say, describe it to the Oracle Analytics product. But what's it been like doing a project like this during the pandemic?
Yeah, I think, the words that, come in mind is definitely unprecedented. Mm-hmm. Our chief operating officer said, wow, we've been on a journey to do digital transformation for the last 3 years. We have selected Oracle to be our platform, not only for analytics, but also for all of the HR transaction and a suite of products, starting from HR, payroll, benefits, talent acquisition, and talent management. And obviously, when you go on such a big digital transformation, you talk about the huge value that you will bring to organization and bring to the leaders is to provide them with insights to the data. So analytics was, part of our scope to go with our digital transformation, and we were supposed to go live in 2020. Mm-hmm. And then obviously, things worked out differently for all of us that year. And so Northwell has treated more COVID-19 patients than any other health system in the nation. Wow. Still, we had a significant team, obviously, with our implementation partner, Deloitte, and Northwell and Oracle team assembled, and we were already in payroll reconciliation testing, getting ready and started to plan, for go-live activities when we had to first pivot 100% into remote setting. Uh-huh. And then kind of slow down some of the implementation activities because significant team members from payroll and talent acquisition and my team from HR technology were deployed to deal with, basically new innovations that we had to create on the spot, right. Related to our response to COVID. At this point, the story of Oracle Analytics is, we always kind of thought maybe it would have been a great idea to start with analytics. Uh-huh. Because we were bringing data from our legacy systems into analytics anyway. So to give this slide, preview to our leaders and say, look, there is going to be a product, it will merge the data, it will display the data for you in a more meaningful way. You would be able to drill down on some of the data and test some of your hypotheses as it relates to your talent insight, recruitment insight, or just basic, HR data. And so we, already had, instance stood up. And then during COVID, when we started, working on completely different projects, trying to understand how many people do we need to hire, how many people do we need to staff at each hospital with, increased patient volume. And so the logical choice for us was immediately is to say, well, we put all of this data onto Excel spreadsheets, and that's a very powerful tool, needless to say. But I remember, on the daily calls, our, analytics manager would try to display the spreadsheet, and it would be crashing every single time because there is just so much data, right? And then if you think about the power of combining different sets of data. So you have one big team of clinicians and operators working on the census data. And they saying, here's our capacity, this is how many beds we have, this is how many patients we're bringing in. And obviously, on that front, the miracles that people pulled in order to absorb that volume. And then on our side, on HR side, we were, providing supply of clinicians that will be able to treat, patients. And so who do we have right now? Who are we able to redeploy from physician practices or even corporate entities? And who do we need to bring in as our augmented staff? We have a major contract with Cross Country that we're bringing in, additional nurses. And how do we know which hospital needs nurses and when? Those are really important questions. And our chief nursing officer on a daily basis would have rounds with obviously her leaders to hear the sentiment of what's going on at the sites, but then she needed to be supported with real data. And so that's the data that we merged. And then it was kind of logical for us to say, we have this tool already. How long would it take for us to stand this up? And we felt, pretty amazing that the first question, I believe in March, we were obviously seeing with our large employee population, you're talking about 75,000 people all living in New York. Our own employees, how many employees are going on leave because of COVID. And so we wanted to see trends in, people applying for leave of absence or people are calling out sick. So we immediately took data from Kronos and were able to generate files, pulled it in analytics, and were able to generate dashboards in a matter of days, which is, pretty fascinating and was extremely helpful just to understand those trends. And then when the decision came that we have a prototype, we have a business that believe in the way how we're collecting the data, how we're displaying the data, is it helpful to make decisions? Once that prototype was built, we also pushed it into analytics. And we're using it right now. We use it for resurgence. And now, obviously we're happy to see that patients have the confidence to come back to the hospital for elective surgeries. So some of the volumes are up as well.
That's
and
good.
So we continue to use, this tool for decision making and also to help us to understand what's the makeup of supply is going to look like, right? Yeah. So our agency, our internal agency that is supplying nurses to different hospitals and have flexibility to move people from one hospital to another, obviously has become a very strong strategy for Northwell. And we're using this staffing dashboard to understand how to, staff that clinical population.
That's great, Elina. I mean, what a journey. And what's interesting about it is that it sounds like it's a very classic story to me. I mean, I think we all have experiences of joy and pain with Excel, right? As you said, It's so powerful, yet has its own challenges. Joey, is this what you're seeing with other customers? Is this kind of the classic case of let's scale out Excel because it's free and convenient. And, and then they say, wait, we need something a little more powerful.
Yeah, you're right, John. It's in that regard, this is a typical story of being able to transition from those singular tools that are isolated and can make it challenging to manage through the complexity of various factors, various people involved, various systems, and yet common integrated decisions that need to have organizational impact. You need to be able to have that management and governance and visibility across the whole business, not just to what your spreadsheet or my spreadsheet may say and trying to manage the logistics. I know Elina's talked about the inefficiency of what work that requires for people to have to convene more often and discuss things. But if I may add to that, what's completely exceptional and not traditional about this story is not only the heroic work that Elina and the folks at Northwell were doing. You heard about the challenge. This was a historic moment with COVID, as you are well aware. So we're honored to have been able to help facilitate the management of this crisis. I thought what was interesting with what Elina just shared as well is you mentioned, Elina, the innovation, considerations of innovation. And if we remember that time, the chaos, the real fear, the real uncertainty of how to manage through this to be able to help citizens who are suffering from this pandemic, it was really impressive to see that Northwell viewed this as an opportunity for digital transformation, not only to solve the immediate, very scary crisis, and be able to more efficiently augment staff and be able to deliver the services and support that the community needed, but also to understand how to make that something that scaled. It wasn't just about a particular tool. It was digital transformation and automating a lot of processes to be able to more thoughtfully and effectively take action that could implement change. So it's really an impressive story, and we're honored to have been able to help support it. It's great work.
Well, and that's what I was interested in, Elina, to know, like, what are you able to do now with the analytics solutions that really weren't possible with your previous efforts? And, what was the compelling use case that finally got you off the ledge, I guess, of Excel, right? Like, because it is so compelling. What are you able to do now that previously was like unheard of, or you just, would have taken a lot longer?
So, I think on one hand, I will say is that, the fact that we have a lot more data that we're able to bring into the system and engage with our workforce to populate this data. Let me explain. So imagine absolutely large health system, and every single team member on the clinical side, obviously, belong to the clinician, and we know exactly the unit that they work on and what type of skills they have. But what we did not get a chance to collect the data and meaningfully organize it is about what are the skills and experience does our workforce have, right? And we all have different career paths, right? I started, my first career was in the respiratory therapy. And now I lead technology department. So how do you bring this data that everyone carefully orchestrates on your CV or resumes into the system? Because then it will become a really powerful tool for us to say, well, even though we only have 2,000 respiratory therapists, we actually have 2,500 people with this type of experience, and then deploy them, right? And then really quickly to understand where people physically located, and how we would be able to, for example, many clinicians signed up to participate and give us extra shifts working for our temporary agency. So how do you go and recruit them for those one-time ad hoc shifts in the most meaningful way? Because we all know there are so many gadgets we carry with us right now that our phone is pinging us every second. So we want to have meaningful communication, with our team members. So that now is the data that we were, trying to collect during pandemic, but obviously we're doing it via surveys, right? And then how do you maintain it? And now we have a platform, right, that it's continuous updates that's encouraged by the team members. And this will be brought up during your performance evaluation or career conversations or any kind of a big initiatives that we have, right? So, and we gradually moved from dealing with pandemic to dealing with resurgence. And now we administering vaccinations, which, by the way, is also requires a lot of staffing needs, right? You need to staff those spots quickly, to provide those services to the community, to the health system, to our patients. So you have the data, and now you're able to put it in the hands of the people that are running those initiatives or the leaders to make meaningful decisions.
Yeah.
And then, another example is, we just, I think, won numerous awards for being one of the most diverse, employers in the nation. But how do you take the step further and see if some of the programs are working, or if it makes the difference in our hiring practices, in our promotion practices, and so on. So we are building a very robust dashboard, for our Office of CHRO, so they could look at the data and see how well some of the implemented programs are working.
Yeah. So Elina highlighted two interesting aspects. One is, I think, it's getting all the data in one place so that it can be analyzed. And then the other is engaging the consumer, the source of the data, to get more data. Is that what you see, Joey, as well, as like the real benefits to this type of implementation over the, kludged together solutions that many people use?
Yeah, absolutely. I mean, it's difficult enough to manage your business with different versions of the truth and data sets everywhere, and without that centralized control and trust that Elina was describing. But also there's initial insights that you can gain. There's visibility across the various factors, some of which you may not have anticipated. So when you're selecting the different sources that you think are relevant for analysis, has that bias of your own perhaps precluded you from seeing the insight that really is the most important? So by getting all that data accounted for, being able to bring in various systems, as Elina's team has done, so that all the analysis can take place and get that out of the day-to-day work of manual data work that people who aren't in the business of doing manual data work and have real, they put vaccines in people's arms, freeing them up to do the work that they need to do. Also the efficiency, the autonomous nature of the work that Elina's team has done. They've been able to automate a lot of the data processes to free people up. But you mentioned, other examples. We are seeing this. There's an organization who was monitoring the spread of COVID across the areas where they have facilities in Europe. And so they could more proactively be able to understand how to allocate resources. That agility that Elina described, of being able to respond to this chaotic moment and trying to apply the most important thing you have, your people, to address the problem. We see it all over. In China, there was an organization that was monitoring the flow of cars within their parking lots, and then the hands on the buttons using machine learning to be able to understand where are people touching most. Fascinating example. And then even again in the UK for Brexit, the government was trying to understand how to also be able to hire people more efficiently, to be able to deal with, okay, how are we going to plan for everything that's going to happen that have to happen with Brexit? So the chaos of business and your most important asset of your people, how can you get the insights into the action to solve that problem? I think Northwell is a great example of that.
Yeah, I love those examples. I mean, one thing that I love about healthcare analytics is that it's never done. Maybe some people hate that part, but I love that there's always still more potential, right? So, Elina, what's still left to be done? Where are you taking this next?
Well, I think right now we have made pretty bold move to actually go live with all of the Oracle products on January 4th. Still in the midst of all this pretty major initiatives that's going on. And another thing is the hiring has not stopped. So that creates a lot of complexity in initial stabilization and hypercare that we're providing right now. So our biggest goal right now, especially as we go through hypercare, and if any of you don't know what it is, it's us caring for stabilization period after such a major go live. And we went live on every single product in HCM suite for every single employee in the health system.
Wow.
So what we're dealing with right now is a lot of stabilization where managers need to get used to using the system. Employees need to get used to doing transactions and getting trust that the paychecks are issued correctly on time. And our HR organization, which is quite large, is getting comfortable with using a new system. And so what we doing a lot of analytics right now in is actually trying to understand behaviors of our employees, managers, and HR, and understanding how transactions are performed. So we're doing it again, before you go to analytics and try to put this big hypothesis and build fancy dashboards. We're dealing no longer with Excel spreadsheets. We're actually using reports within Oracle Suite, but really trying to understand what are the biggest problems right now we need to solve. And then we are going to build meaningful dashboards that we're going to continue to roll out to the system. Another important strategy that we have is that not to overwhelm our managers with too much information and too much data. So right now, what's important to our managers? That they get employees hired in the most expeditious way. So we build a dashboard that shows how many positions we have open, how many candidates we have, who's in interview status, so the managers have a full visibility to recruitment process. That is our and then they're gonna say, wow, this is fantastic. We want more, but we want them to be in the system. There is a reason that they go to the system, right? And the good news is that I go in the system because this week I was processing merit increases for my team. So, but at the same time, there is a tile that says analytics. And so I could log in and see, oh, I do have 4 positions open. What's going on with that? And then, continue to understand even some of the transactional data related to our recent implementations. So many team members and the leaders right now involved in performance review conversations. So what are we seeing, right? It's been a tremendous year for 2020. Is everyone going to be an exceptional employee? And how many team members are posing self-assessment? How does it match? What kind of insights our leaders are looking for? So those are going to be really important initiatives for us to really embrace all this digital transformation that we enabled. And we're also using another Oracle product that's called Oracle Guided Learning. And so imagine now implementing such a large complexity and scope project all remotely, and being very selective on how much time we're going to take from managers, especially frontline managers, not to be in a sort of classroom setting. So they are using self-paced, just-in-time guided learning, and we want to understand analytics from that as well. What works, what doesn't, and what like, are you watching all of the videos?
Yeah.
How long are you doing this? And so right now we posted a welcome video from our CHRO, and that is the top trending video in the system right now, which
That's
we are
so
extremely happy for him, and that people feel that logging in and having this personalized and human touch of someone talking to you about investment in technology, investment in our people, to provide those beautiful tools for our team members.
Awesome. Well, thanks so much, Elina and Joey. This was an enlightening conversation. It's great to see analytics making an impact on healthcare. And thanks everyone for watching. If you want to find more great health IT content like this, be sure to check it out at healthcareittoday.com. Thanks, Elina. Thanks, Joey.
Thanks,
Thank
John.
you.